Welcome back to What's Now, continuing the conversation about your health. Technology has come a long way, especially with health and especially for those individuals that are managing chronic diseases such as diabetes. Here's more information on the latest in health tech and how it's helping individuals right now here in 2020.
COVID-19 has many feeling stressed and isolated, intensifying mental health challenges across the country. And now, heading into a holiday season where many are foregoing traditional gatherings, the space between us can feel even greater, particularly for children and families managing chronic health conditions like diabetes. Now, a survey from Abbott and Opinion Health reveals just how great of an emotional impact diabetes has on children and families. Joining us to explain how technology can help ease that burden is Dr. Kurt Midyet, pediatric endocrinologist from Midwest Women's and Children's Specialty Group in Kansas. Dr. Midyet, thanks for joining us today.
Thank you for having me. Excited to talk about some of these important topics.
What are some of the general health issues people with diabetes will be dealing with while navigating the holidays during COVID-19?
Well, as you know, diabetes is a medical disorder in which there is the inability to effectively regulate or control the glucose levels or sugar levels in the body. We know that there are plenty of things that impact how these sugar levels rise and fall, different activities, different foods, et cetera. But we also understand and are recognizing more and more that stress plays a big role in how these glucose levels rise and fall. And as we all know, we're dealing with a lot of stress during this difficult pandemic with COVID, but now we're moving into an even greater degree of stress that we can see sometimes with the holidays. They're going to be more disrupted. Kids may not have the same school times, or they may not be able to see the loved ones that they're planning to see. And all of these can play a direct role in the medical management of their diabetes.
And tell us about this new survey and what it reveals about the way diabetes affect children and their parents.
This was a survey that was conducted by Opinion Health and supported by Abbott, who I'm representing to talk today. It is really insightful because it was a deeper dive into factors other than just foods and activities, trying to look at what plays a role in defining the stress that our patients see. And it was very helpful and insightful for me. 73% of the kids interviewed over 6 countries, including the United States, reported that they had an increase in their anxiety due to their diabetes compared to kids that did not deal with diabetes on a day-to-day basis. But what was also very important is that almost half of the parents of children living with diabetes reported that their own mental health was impacted by their child's diagnosis. And 38% of those parents actually sought out mental health professionals to deal with this issue. So it's a very important thing to recognize and to communicate with our patients.
So what can people living with diabetes or their caregivers do to make managing diabetes even easier, especially now?
Well, I think importantly is just recognizing how much of an impact stress can have and empathizing with the patients and their families and doing our best to give an understanding about that. I think that can be helpful. But what is also very exciting is the technology that we're seeing developed that I think is really going to have a transformative effect on how we manage diabetes and really help to reduce a lot of the burdens that we're seeing.
And how are new technological advancements helping people better manage their diabetes, especially now, once again, during COVID-19?
A good example of this is how we gather information. Diabetes is really dependent on an understanding about what's going on inside the body. And the conversations that I usually have to have with my kids who are newly diagnosed is that I have to inform them that I need them to poke their fingers with a sharp device to get a sample of blood 8 or 10 times per day. You can imagine that's not the funnest conversation, nor is it something that the kids are looking forward to. But with the Freestyle Libre 2 device, I now have the opportunity to gain information about their glucose levels minute by minute without having to poke their fingers. This is a small device, not much larger than the size of a quarter, that's placed on the back of their arm, and they can use a reader or their phone to actually swipe over the sensor and collect immediate information about their glucose levels. That not only helps me, but also helps the kids and their parents better manage their diabetes.
And how can we find more information and more resources about this?
I would recommend that everyone visit myfreestyle.us. It's a great website that has information about how these devices work and also valuable resources as well as safety information about how this device is being used in our kids.
Well, thank you so much, Dr. Midyet, for joining us today here on Park City Television with this important information, really helping children, families, caregivers managing diabetes during this tough time.
Well, thank you very much. I appreciate it, and have a great holiday.